Hi guys, my name is Dr. Sammy Gibson with Eastwood Animal Clinic here in El Paso, Texas. Today we just wanted to talk about some of the questions that we get from clients that are pretty common. So we'll kind of talk a little bit on, when we generally recommend some of the vaccines and the spaying and neutering of our feline and canine patients. For the most part, I'm just going to talk about puppies, and it should be unanimous, just to simplify. Puppies, for the most part, you should get them from your breeders or your adoption agency or whatever when they're about 6 weeks old. Between 6 to 8 weeks old is when they want to be weaned off of mom. And that's a good time to go ahead and get their first round of vaccines. We do encourage owners to get their first round of vaccines at a veterinarian. There's a reason it's through a veterinarian and not over the counter, just to try and minimize some complications and relapses and things like that. Typically, every clinic will have a little bit different protocol. Here at Eastwood Animal Clinic, what we like to do is do a series of 4. And beginning of 2017, one of the agencies came out with recommending 4 to 5 parvo shots in endemic areas. And we have a lot of parvo and distemper here in El Paso. And unfortunately, it does claim some puppies here and there. But we do pretty good with parvo overall. So getting back to the vaccine protocol, usually we'll do their first one at 6 or 8 weeks, and we'll go about every 3 to 4 weeks after that and do a series of 4. What I try and do is encourage owners to multitask on their visits, get as much done as they can at one time so they don't have to come back 4 or 5 times for just little bitty things. There are pros and cons with that, and we can touch base on that in a later video. With the vaccines, usually you'll come in, you'll check in, we'll try and give the DHP in the back left area. Once they get old enough, past about 16 weeks, we'll get them updated with their rabies shot. I try to have owners multitask, and when they're doing their last round of vaccines, go ahead and schedule getting spayed or fixed. So you can do your vaccines, do your microchip, get the patient fixed, do all those things at one time. The microchip is a pretty big needle, it's very sharp, so most patients tolerate it very well. But if you're going to go under anesthesia, they might as well not feel it, and you might as well make it as painless as possible for your patient. That's why you're coming, is you care about them and you want to do the best you can for them. And we try to help you out with that and do the best we can together, and I'll do the best I can to help you guys out. Typically, we'll shoot for the earliest being 4 months, but ideally about 6 months is a good time to get most patients fixed. It just kind of depends on when you started the vaccine series, because you don't always get these guys as a puppy or a kitten. Sometimes they're older and you took them out of a bad situation or something like that. Some of the other things that we'll do is, depending on the breed, every dog will have a different time frame that's generally recommended. Typically your smaller dogs or medium-sized dogs, anything less than about 50 pounds for their adult weight, we'll try and do at the 6-month mark, somewhere in that ballpark. The larger the breed, usually the later we will try and push getting them fixed. So for our large breeds like your labs, your retrievers, German shepherds, things of that nature, the 6 month to 8 month is a good time to get them fixed, in my opinion. And for our giant breeds, everybody will have a little different opinion with that, but I try and make sure, like our bull mastiffs, Great Danes, Great White Pyrenees breeds, we try and fix around a year, maybe even a year and a half. Some of the other things that make a difference is it a male versus a female? There's pros and cons, and honestly there is some conflicting information out there, and it just depends where you look at the information and who you talk to in their experience. At the moment, the general recommendation is to still get your patients fixed. For both male and female, it does seem to minimize the risk of developing the different cancers, whether it's testicular, prosthetic cancer, or the female cancers like mammary cancer, mammary tumors, ovarian, and different diseases associated with that can turn into surgical emergencies. There are some downsides. Some of the research that's out there talks about particularly large breed dogs and giant breed dogs. If you get them fixed too early, it predisposes them to having weaker ligaments and therefore having more ACL tears or knee tears. And how much is out there, I don't know. Clinically, I haven't really appreciated that myself, but that's some of the other conflicting research that's out there. Probably the biggest downside that I see to getting your patient neutered or spayed is they like to get fat. They like to turn into little jelly rolls and your little pumpkin, and they'll just snuggle up with you, so you got a bigger heater on your lap, and they'll snuggle and kiss you and love you. But that's probably the biggest downside that I see with these guys when they get fixed, is they like to get fat. Most owners, if I tell them that up front and they're aware of it and cognizant of it, they pay attention to it, and you want to keep an eye out for it. Most of the time, they're not able to go get their own food. They can't go to McDonald's, they can't go out to eat, they can't go to the grocery store for themselves and pay for it and get whatever they want, whether it's Twinkies or whatever. But, you know, just pay attention to how much you're feeding them. And what you want to do is keep them with the right amount of curves in the right places. And I'll go over another video here in a little bit that kind of talks about the ideal body weight for your patient. But hope this helps you guys out a little bit. If you have any questions, please let us know. We're at Eastwood Animal Clinic, and our website is animalclinicelpaso.com. We do have a Facebook page, we do have a Twitter, and our phone number, if you have any questions, is 915-593-0713. Hope you all enjoyed the video, guys. Talk to you later. Bye.